Healthcare debate in this country thus far, rarely, if ever, have we seen Republican and Democratic senators stand side by side in any context, let alone in a national television interview, and offer bipartisan solutions to the problems of our ailing and outdated healthcare system, one whose basic template was drawn in the middle of World War II. Right now, on the morning meeting, we have that opportunity, and we are honored to have it. Here to talk exclusively with us and you all about 3 joint amendments that these two are filing today: Republican Senator Susan Collins of Maine, and all the way across the country, Democratic Senator Ron Wyden from Oregon. We've got the corners covered. It's a pleasure to have both of you with us. Thank you. Ron, I'll begin with you, Senator. Talk to us about what it is that you're attempting to achieve. What is the intent of the 3 amendments of the day?
Dylan, what we want to do is make sure that Americans have the choice to have a choice. This is not mandatory, and what we want to emphasize is that Americans are looking for common sense ideas. They don't care whether it's a Democratic idea or a Republican idea. They're looking for ways to hold down their health care costs. They're looking for ways to hold down their premiums. If you're a single mom, say in Maine or Oregon, you're not interested in some kind of ideology. You want more competition, more choice in the marketplace. Senator Collins and I are teaming up to give that to you.
Senator Collins, what specifically is it about this set of amendments that you found so compelling that you were willing to step into the bipartisan theater in public as you have today?
Well, both Ron and I were very concerned that the bill could actually increase the cost of insurance for many Americans. So our goal was to provide more affordable choices. I also felt strongly that the American people are really tired of the partisan bickering in Washington. They want us to come together, particularly on an issue that affects every single American in this country. So that's what we've done with our proposal to give more affordable choices to employers and to individuals who are buying insurance on their own.
And I'm interested, this is a question.
What's going on?
Yeah, go ahead, Senator.
What's going on is a lot of people think that just because you can go to the exchange, your employer is at the exchange, you're automatically going to have choices. That's not the way it works. Your employer will be able to make the choice, but you aren't going to have the choices without what Senator Collins and I are talking about. So what we'd like to do is say that if the employer wants to empower the individuals to have more choices, the employer, the individual, families will have those kinds of opportunities. It's a tax write-off for the employer. If they give the voucher, it's tax-free to the worker. But at the end of the day, it's what you've been talking about on this show, which is the substantive idea of more freedom, more opportunity for individuals to hold insurance companies accountable and their premiums down.
Senator Collins, have you had a response from some of your Republican colleagues at this point to this particular set of amendments and your decision to create a bipartisan representation for an agenda on health care?
I believe that my Republican colleagues recognize that there are a lot of problems with this bill. That's been evident in the debate. And look at Ron's and my effort to combine forces as trying to tackle in a constructive way one of the many issues involved with the bill. I don't think that any of my colleagues thinks that our amendments solve all of the problems, but they recognize that it's a good faith effort to give more choice. Let me give you a specific example that I hope will have widespread support. What we're saying is that if an individual does not receive a taxpayer subsidy, that individual should be able to buy a wider choice of insurance policies than is allowed currently under the bill. We also want to give small employers more access to buying policies on the exchange. Again, more competition, larger risk pools, that should help hold down prices.
Yeah,
and that should be something we should all support.
Clearly. Last question for you, Senator Wyden. Where would you run into resistance? When you look at create a plan that says, listen, we're going to create more personal empowerment with a voucher proposal so employers can either pass the voucher on to me as the employee, and I can buy it, spend it on the exchange so the tax subsidy goes around. Catastrophic coverage option in here, again, allowing those who feel like they simply need the optionality to protect themselves from a catastrophic event will have that option within the scope of things, and then some sort of a structure to prevent insurance companies from basically price gouging using a system we won't get into right now, but I'm sure it will be debated. It basically uses incentives in a tax structure to prevent price gouging. All of this seems very rational if you believe in, again, a free market and choice and all the rest of it, which, again, is a very American ideal. Where's the resistance to this, Senator Wyden?
I think, Dylan, we're always up against some who are resistant to new ideas. But when you can come forward in this town, and thank goodness you're willing to air these ideas, because frankly, there aren't a lot of folks doing that, and you're saying this is common sense. There really hasn't been a marketplace in American healthcare for decades. We are not forcing particular requirements on employers or individuals. But at the end of the day, the Collins Wyden effort is saying if you want to have the choice to have a choice, employers, individuals, and families, working moms who are getting hammered, say in Eugene, Oregon, or Roseburg, Oregon, we're going to make that available to you and hold insurance companies accountable. Even the insurance provisions are all about a marketplace approach, not big government, a marketplace approach.
Understood. Senator Collins, thank you so much for giving us a piece of your morning. Senator Wyden, thank you so much for giving us a piece of your morning. Best of luck in attempting to, again, resurrect the most basic American principles, a marketplace, and equal opportunity for everybody not to get price gouged and to be able to select the program that is best for them. We can do it with our car insurance, please. We can figure out a way to do it with our health insurance. Straight